Finding your way with ocular melanoma, join me, host Tara McCannell, as I share with you everything I know about ocular melanoma. I hope you will learn, get your questions answered, and be motivated to empower your healing and to live your best life. Visit my resource page, sayhart.com/ocular melanoma. That's SEYHART/ocular melanoma for more content and support. You will find access to my book, Finding Your Way with Ocular Melanoma, which is a handbook for patients and families, resources such as past recorded webinars that I've done on special topics related to ocular melanoma, all of my past videos, past podcast episodes, and information around group support that I can personally lead. Please rate, review, follow, subscribe. This helps more people who are looking for information find us more easily. Today, I'm going to talk about red eye after ocular melanoma treatment. What is red eye? Red eye is when the white of the eye, which we call the sclera, and which is composed of the conjunctiva, which is the superficial layer that is on top of the eye, when the vessels in those layers become engorged, injected, they swell, and so the eye looks red. There are different reasons for red eye, and we will address the most common and also some less common and what you can do about it. The first reason for red eye happens right after you have your surgery. And this is brachytherapy surgery. This is surgery to place tantalum clips if you're having proton beam radiotherapy. Either way, the eye is opened. So the conjunctiva, which is that superficial layer, is opened and the plaque is placed or the clips are placed, and then the conjunctiva is closed. And this sort of disturbing the outer layer of the eye will make it a little bit red. And this is actually normal. So, right after you have surgery, usually for a couple of weeks, the eye should look red because those tissues were moved. So, the red eye associated with after surgery is very normal. And what can you do about it? Certainly take the postoperative drops that you've been prescribed, and those will include a steroid drop, they may include an antibiotic, and those are the common drops that people use, and certainly take those. The steroid drop, which we usually call prednisolone, prednisolone acetate, 1%, is a milky white drop that you shake and you place on the eye. This drop will speed up the improvement of the red eye after surgery. And it will also, because it is anti-inflammatory, make the eye feel more comfortable. So use the prednisolone drops as prescribed. That will help. In addition, what you can do is use artificial tears. So these are the preservative-free, over-the-counter drops that you can get at any pharmacy. And use those as well as the prescription drops. Keeping the eye well lubricated will help it heal faster and help the redness go away faster. If you think about it, after surgery, the surface of the eye has been disrupted, it has been sewn shut, there will be likely sutures placed, so it's very irregular. And this irregularity makes your natural tears that your eye produces, it makes your tears dry up faster. So tears will evaporate off an irregular surface. That's why it's important to use artificial tears, lubrication to help speed up the recovery. It is not unusual for the redness of the eye to last several weeks. And during this recovery time, it's important that you notice that the redness and a little bit of discomfort gradually get better day by day, week by week. If you find that the redness has improved and then it gets worse and the eye feels sore, it's important to have your ophthalmologist check the eye to make sure that the healing is happening appropriately. Sometimes there can be inflammation as part of healing, and this is very normal. The whole eye is inflamed after surgery, and we gradually wait for this to improve. But occasionally you can have a flare up of the inflammation, and the eye will be a little more sore, tender, and look more red, and also be sore around the eye. So the eyelid and the skin around the eye might be sensitive. If this happens after the surgery and during a period where you presumably are recovering, it's important to have your eye checked. If there is an inflammatory response, your ophthalmologist may want to give you additional steroid drops. So, just a cautionary note about steroid drops. Please be certain that you are taking them under the guidance of your eye care provider. Because many patients and many of us know that when we take the steroid drop, the eye feels very comfortable right away. So sometimes people will just grab the prednisolone drop and put a drop in for comfort, when instead it's much better and safer just to use the artificial tear for lubricating. The risk with a steroid drop is that if you use steroid eye drops on a consistent, regular basis and you don't get the eye monitored, meaning nobody's checking the pressure or checking the vision, the eye can develop elevated intraocular pressure. And this is a known side effect of these Predforte prednisolone eye drops. And that's why it's important to use them in a very limited period of time, like right after surgery, under the direction and care of your ophthalmologist, and really not to use them as needed in the future. And it's always important not to have to rely on prescription drops unless it's treating something specific, like an acute inflammatory reaction. So the redness of the eye after you have your surgery is very normal. And sometimes even a month or two after you've had your brachytherapy or your melanoma surgery, you may find that the eye remains a little bit red. Again, as long as your eye continues to feel more comfortable, this is normal. And I often tell my patients to continue to use artificial tears very liberally because even a couple of months after surgery, the surface of the eye is not as perfectly smooth as your other eye, which may not have had any surgery. So, keeping it lubricated will keep the eye comfortable, will keep the eye moisture present, will avoid the dry eye, irritated symptoms, and ultimately the redness will be much less. And it's important to note that everybody recovers a little differently. Some people, within a couple of weeks, it doesn't even look like they had brachytherapy or melanoma surgery. Other people, several months after, there's a little bit of lingering redness, and we just monitor and make sure that everything else is recovering. So, what are other types of red eye? These are the red eye that we see associated with the period shortly after having surgery. What about in a year or two? What are the reasons for red eye? And I want to point out that red eye in general is a very common situation that even people who've never had their eye treated with melanoma may experience redness, irritation, the vessels of the eye looking, really prominent. Dry eye is a very common condition that affects people as we get older. We don't make as much tears as we do when we're very young. And so using artificial tears on a regular basis is very helpful at reducing the redness of the eye. There can be other reasons for red eye that happen after your treatment. Now, we're talking a year or so after. And these are usually related to inflammation. And I have a previous episode where I talk about inflammatory eye and what we can do about it, but there can be different degrees of inflammation even several years down the road. And you may not have a technical acute flare up, meaning you can see the cells and such, but you might just have a little bit of achiness and the eye's a bit red, and then it sort of goes away. And it's not unusual for people to experience sort of episodic redness, a little bit of achiness, and then it recovers. And this can happen after your treatment. And the reason I believe this happens sometimes is that when the melanoma is killed, that dead tumor sets off quite a bit of inflammation as the body's white blood cells come in to clear it. So there's a bit of an inflammatory response associated with tumor death. And, the melanoma dies after the radiation, but it can also continue to scar, to sort of continue to wither away as years go by. And whenever there's a little bit of extra inflammation from this dead tumor, which is together with the living eye tissue, there can be a little bit of localized inflammation. And people will often notice that the eye gets a little red and it's tender. And the signs that this is sort of an inflammatory response are that oftentimes the area around the eye, like the forehead, the cheek, maybe even the eyelid, are feeling a little sore and tender to touch as well. And that people notice that the eye is achier towards the end of the day. So when you wake up in the morning, things are fine, but towards the end of the day, after you've used the eyes a lot and that eye is just gone through a little bit more, it's just a little more sensitive and feeling uncomfortable. And often redness can be associated with that. You don't necessarily need to get out the steroids to treat that. I often recommend using simpler measures like using an ice pack because something cold and that's chilled will also help reduce inflammation. So use an ice pack. Use even like some frozen peas or ice chips. You can get a mask that you can place over your eyes that you can place in the freezer that has a similar cold effect. I recommend that people put their artificial teardrops in the refrigerator so that when you apply your artificial tears, they go on cold. So not only do you get lubrication, but you also get sort of a reduction in the inflammation of all the tissues because you're putting something cold on the eye. And I think that's just a really simple, neat trick that a lot of us can do. Put your tears, put your drops in the fridge, and apply them to the eye cold. And that way you have some added benefit. So those are the commonest reasons that our eyes look red after melanoma treatment. There are some less common things that we often worry about. And one of the things that people worry about is that I'm getting an infection. Okay. It's very rare to get an infection on the superficial parts of the eye months or years after surgery. But an infection is possible, and the most common type of infection that causes red eye is a viral conjunctivitis. So pink eye after you've had an upper respiratory tract infection or cold, and then you get sticky, gooey red eye with that. So that's the most common viral type. Getting a bacterial infection is very uncommon that long after surgery, but we always worry, is my eye infected? And usually it is not. It rarely is infected with something that you need to use prescription antibiotics. And then another reason the eye can be red is if your eye is painful and red, it's important to have that checked. I mean, it's important if something you're experiencing a change in your normal baseline, but if there's pain, and particularly if there's pain and your vision has decreased and the eye is red, you need to be seen by your ophthalmologist immediately to figure what that is. Sometimes there are types of acute glaucoma where the pressure may be high and then the eye is painful and the eye is red. And these are things that are possible, particularly after ocular melanoma treatment. There's a condition called neovascular glaucoma where the inside of the eye has suffered some damage from the radiation and the vessels in the retina are not working properly. So the tissues inside the eye don't get nourishment. So the eye grows its own set of new blood vessels, which can cause problems. And these new vessels tend to grow along the iris in the front of the eye, and that blocks the drainage channels so that the pressure and the fluid in the eye has nowhere to go. So it builds up and eventually becomes very painful. Usually it's related with decreased vision, and usually the eye is very red. And these are, of course, more acute situations. But if you're starting to develop some of these problems, be sure to visit your ophthalmologist. So I hope that this was helpful and that you've learned a little bit more about red eye, dry eye, what's normal after surgery, what's normal that can happen with periodic inflammation, and just to be aware of acute emergencies. I encourage you to please ask me anything, ask me any questions. I look forward to sharing more of all the information that I know about ocular melanoma with you. Thank you.